Chronic low back pain is one of the most common conditions that people suffer from, affecting mobility, work, and quality of life. But did you know that physiotherapy can help manage and even eliminate this pain? Today, I will walk you through what causes low back pain and how physiotherapy helps. Simple exercises, you can do it at home. What causes low back pain? Chronic low back pain is typically caused by the issues like muscle imbalances, poor balance, herniated discs, arthritis, or prolonged sitting. Weak core muscles and tight low back muscles often make the common condition worse. Common causes: poor posture and prolonged sitting, weak core and gluteal muscles, disc degeneration and herniated discs, muscle strains and ligament sprains. How does physiotherapy help? Physiotherapy focuses on reducing pain, improving mobility, and strengthening the muscles that support your lower back. We can use combination of manual therapy, exercises, and posture correction techniques. Physiotherapy treatment includes spinal mobilization techniques, core strengthening exercises, stretching tight muscles, postural training, and ergonomic corrections, dry needling or acupuncture for pain relief. Effective exercises for lower back pain. Now, let me show you some simple but effective exercises. You can do it at home to relieve back pain and improve strength. Exercise number 1, pelvic tilts. Lay on your back with the knees bent and feet flat on the floor. Tighten your core and flatten your lower back against the floor. Hold it for 5 seconds and release. Repeat 10 to 15 times. It helps